Hi there. So we're gonna go over a treatment plan for a client with hybrid kyphosis, which is a form of upper cross syndrome. In order to start off, we're gonna go over. We're gonna start with soft tissue work. Then we're gonna do some stretching exercise, and then we're gonna do a strengthening exercise for the mid trapezium and in general for the scapular muscles. Soft tissue work. We're gonna focus on the pectorals muscles and neck extensors, which are the tight and short musculature of the upper cross syndrome. So let's start off with the pectorals. We're gonna make sure that we don't jump on it right away. So we want to gradually increase the pressure. And while we're doing it, we also want to move around so we can actually target the whole muscle. If you feel like we need to apply a little bit more pressure, we could always use lacrosse ball, but we don't have a lacrosse ball, we're gonna use a baseball. Anything can help. So we can actually start off with the hand, or then we can do it laying on the floor. Apply the same thing on the both sides. Just gonna do one side for enough time. Then we're gonna do the stretching exercise. The stretching exercise is gonna help us to open up the rib cage, which is actually very important in the upper cross syndrome exercise. When we're dealing with upper cross syndrome, this one is gonna consist of placing the elbow on the door frame, and we're gonna twist and gradually increase the range of motion until we find that we are that we can no more open up. Make sure that we hold at least for 30 seconds and about 2 minutes, up to about 2 minutes would be great. And just hold it there. Great. We should do it on both sides, and also we can repeat the same process about 3 times. It will be ideal until we can actually have the perfect range of motion before we start the strengthening exercise. So for the strengthening exercise, we're gonna be doing a YTW one, and the YTW is gonna help us to strengthen the rhomboid, the mid and lower trapezium, and the rest of the scapular muscles. For this patient who actually have problem in the shoulder, this is gonna make the patient not to rely too much on the shoulder muscles and actually get to use those muscles that are too weak. We're gonna start off with laying on the ball. Obviously, make sure that the client is able to use the ball, otherwise we would use another exercise. And I'm gonna demonstrate it without the weight. First, we should do it without the weight and start off with a Y, thumbs up, and I'll place my finger in between the scapula and have the client squeeze the scapula, squeeze my fingers as much as they can. Make sure that we make the same emphasis concentrically, isometrically, and eccentrically. Same time, so we can work evenly in those muscle actions. Then same thing with the weights. Be Y, slowly down, T, hold it, and slowly down, and W. Keep repeating this, and make sure that you finish when you start to feel fatigue, and do some stretching after, and that'll be it.